Most people over 70 ignore the early warnings. They think it's just aging, just another ache, just part of getting older. But bone cancer doesn't announce itself with a dramatic entrance. It whispers, and by the time you're screaming, it may already be too late. Here's what terrifies doctors. Bone cancer in older adults is one of the most overlooked diagnoses in medicine. Not because it's rare, but because its symptoms disguise themselves as normal aging. That stiffness in your hip, that dull ache that won't quit, your body is trying to tell you something. And you need to listen before the window closes. Bone cancer, particularly in people over 70, comes in two forms: primary bone cancer that starts in the bone itself, and metastatic cancer that spreads from elsewhere. Both are silent assassins. Both send warning signals that most people dismiss. Today, I'm going to show you the 5 signs that should never be ignored. Number 1. Persistent bone pain that changes with time. This isn't your typical arthritis. This is pain that starts subtle, maybe just a dull discomfort in one spot. Your hip, your spine, your shoulder. At first, it comes and goes. You blame it on the weather, on that old injury from decades ago, on sleeping wrong. But then it changes. It becomes constant. It intensifies at night, waking you from sleep when you should be resting. The pain doesn't respond to normal pain relievers the way other aches do. And here's the critical detail most people miss. The pain stays in one specific location. It doesn't migrate around like arthritis does. It plants itself in one bone and refuses to leave. This is your first and most important warning sign. If you have bone pain that's getting worse over weeks or months, especially pain that disrupts your sleep, you cannot afford to wait. Number 2. Swelling that appears without injury. Weeks or sometimes months after the pain begins, you might notice something else. A lump, a subtle swelling over the bone that hurts. It might be warm to the touch. It might be tender when you press on it. Many people assume they bumped into something and forgot. But you didn't. This swelling is happening from the inside out. The tumor is growing, pressing against surrounding tissue, creating inflammation and visible changes. By the time swelling appears, the cancer is often advanced. This is why catching the pain early in symptom 1 is so critical. The swelling is your body's alarm bell ringing at maximum volume. Number 3. Unexplained fractures from minor trauma. This is where bone cancer shows its most devastating card. The tumor weakens the bone from within, creating areas of fragility that can't bear normal weight. You step off a curb wrong and your leg snaps. You lift a grocery bag and your arm fractures. These are called pathological fractures, breaks that happen without sufficient force to explain them. For someone over 70, doctors often attribute these to osteoporosis. And sometimes they're right. But if you've had persistent bone pain before the fracture, if the break happens in an unusual location, or if you've had more than one unexplained fracture, bone cancer must be ruled out immediately. A fracture isn't just a broken bone. It might be your skeleton crying for help. Number 4. Profound fatigue and unintended weight loss. Cancer cells are metabolic thieves. They steal your body's resources, burning through energy at an abnormal rate. You feel exhausted in a way that sleep doesn't fix. Activities that were easy 6 months ago now leave you depleted. You're eating normally, but the pounds are falling off. 10 pounds. 15 pounds. Your clothes hang loose. People comment on how thin you've gotten. This systemic symptom means the cancer may be more widespread. It's no longer just a local problem in one bone. Your entire body is being affected. Combined with bone pain, fatigue, and weight loss create an urgent picture that demands immediate medical investigation. This isn't normal aging. This is your body waving a red flag. Number 5. Reduced mobility and increasing disability. This one is insidious because it happens gradually. The bone pain makes you move less. You start avoiding stairs. You stop taking your daily walks. You ask others to reach things for you. Slowly, almost imperceptibly, your world shrinks. If the cancer affects your spine, you might notice weakness in your legs, difficulty with balance, or even problems with bladder control. These neurological symptoms mean the tumor is pressing on your spinal cord, and this is a medical emergency. But even without nerve involvement, the progressive loss of function is significant. When bone pain starts stealing your independence, when you're reorganizing your entire life around avoiding movement, something is seriously wrong. Here's what you need to understand. Bone cancer after 70 is treatable, especially when caught early. But early requires action. If you have persistent bone pain lasting more than 2 weeks, you need imaging. An X-ray at minimum. Often an MRI or CT scan. Blood tests to check for cancer markers. A biopsy if anything looks suspicious. The greatest tragedy doctors see is patients who waited, who normalized their symptoms, who convinced themselves it was just age. By the time they finally came in, the cancer had spread. Treatment options had narrowed. Time had run out. I know this information is heavy. I know it's frightening to consider that persistent pain might be something serious. But knowledge is protection. Awareness saves lives. Every single day, someone over 70 is diagnosed with bone cancer who wishes they'd acted sooner. Don't be that person. Don't let false reassurance about normal aging steal weeks or months of critical time. Your body is the most sophisticated diagnostic machine ever created. When it sends persistent signals, especially the 5 we've discussed today, you have to listen. If you're experiencing any of these symptoms, make an appointment with your doctor this week. Not next month. This week. Write down your symptoms, when they started, how they've changed, what makes them better or worse. Be specific. Be persistent. If your doctor dismisses your concerns, get a second opinion. You are your own best advocate. And if someone you love is over 70 and complaining of bone pain that won't quit, share this information with them. It could be the most important conversation you ever have. Bone cancer whispers before it screams. But now you know what to listen for. The pain that changes. The swelling without cause. The fractures that shouldn't happen. The fatigue that steals your life. The mobility that slowly vanishes. These aren't just symptoms of aging. They're your body's language. And now, you can understand what it's trying to say.